Well, now, we've all read this paper on statins for the primary prevention of cardiac disease, but do we actually know what the paper's talking about?
Well, I'm not clear what cardiovascular disease actually is. It seems, as far as I understand it, to be heart disease. Does it cover strokes and heart attacks, etc.? I assume it does, but I think it ought to say a little bit more about what it actually is. And also, perhaps not use words like mortality and morbidity, just change those for death and illness or disease. They're probably more commonly understood.
And I think that they talk about statins, which I think they should explain, are, as I understand it, a drug which reduces cholesterol and helps your blood pressure. And I think they need to tell you a little bit more about that and their effect on people.
Well, I'm completely lost about where it's talking about systematic reviews and the like. I mean, I presume this is just looking at the drugs and making sure to make sure that they're safe for us to take them. But I wouldn't know about all this, and it's talking about things like controlled trials and central medline, etc. Well, I'm guessing that this is just for the researchers. It's certainly not necessary for us to know it, just as lay members.
No, there must be specific online databases, I think, that only they can get onto if they're medically inclined, working on it.
And then it says 14 randomised controlled trials comparing statins with usual placebos. Well, are most people going to know what a placebo? I mean, I think I do.
Which is what?
Well, I think it's a tablet that's made up of something like starch, and you use that in a test against the normal tablet. So some people take an actual statin, and some people take a tablet that's just made of nothing.
But the people taking the placebo think they're taking the real thing.
I think that's right, yes.
Mm-hmm. And it seems a shame to bring in cancer when really we don't feel there's a lot of need to have that included in, as the trial isn't about cancer.
No, it's just making more assumptions and people more worried.
And one thing that confused us, it makes this statement, summary: coronary heart disease and stroke events were reduced with the use of statins, as was the need for revascularizations, which is some medical surgical treatment, we believe. Statin treatment reduced blood cholesterol. Well, that appears to be giving it good marks. But then later, at the very end, it says, we recommend that caution should be taken in prescribing statins for primary prevention among people at low cardiovascular risk. It's not exactly contradictory, but it needs to be made a bit clearer.
Yes, I mean, who are at high risk and who are at low? We just don't know.